The South African Health Products Regulatory Authority is considering to up-schedule over-the-counter medicines containing codeine. The South African Medical Research Council has conducted a study about the abuse of codeine among consumers and found that a great number of South Africans are addicted to codeine. Codeine is highly addictive and can be found in painkillers and cough mixtures that can be purchased over the counter in pharmacies and stores. The study also found codeine addiction among children who buy cough mixtures and then mix it with fizzy drinks. Joining us now via Skype is Professor Charles Parry from the South African Medical Research Council to discuss this with us. Good to have you, Prof. Thanks very much for talking to us.
Good morning, Leanne. Hello.
Codeine addiction. How big is it in South Africa? What do our stats say?
Well, the South African Demographic and Health Survey in 2016 found that 1.5% of men and 2.3% of women report misusing codeine products in any year. That may not sound like a lot, but it translates to quite a high number of people who are misusing this drug. But of those, obviously, some of them are only misusing it occasionally. But of that, there are obviously a proportion who have an addiction and who are dependent on codeine products.
Yeah. So, I mean, is it easy to get addicted to codeine if you keep on using it for long periods of time?
It is, very much so. It's an opiate like heroin, and people develop tolerance in a very short period of time. And some people can metabolize it into morphine quicker than other people.
Yeah, and this is a problem because, as we say, these are freely available over the counter. You don't need a prescription to get many tablets or syrups that contain codeine, and hence this conversation is now back in the headlines. And you know, what would you ideally like to see?
Yeah, I think we mustn't rush into upscheduling codeine because that's being considered or put on the table now. And I know Namibia upscheduled it, I think, a year ago. But I think there are a number of steps we need to do. It can't be business as usual. It is being misused by people. But to upschedule it would actually put it out of the reach, particularly of the poor, who would then have to get a prescription for getting a mild pain relief. Many of us sometimes need something for back pain or something just for a day or two. And then you're taking it away from people because of a few people who are abusing it. I think there are steps we need to look at first before making such a drastic move towards upscheduling. But yes, people do misuse it. There's a lot of ignorance about it.
Yeah, and that's the reality. So I suppose, I mean, there are a lot of studies that have been done. I've been reading through a couple of them, in fact, just to talk about codeine dependency and in comparison to the rest of the world, how South Africa is doing. So let's perhaps look at a little bit of that and draw up a comparison. There are a couple of countries that have limited the amount of codeine you can buy over the counter. For instance, in South Africa, and obviously you're the expert, so you can tell us more, we can purchase 20 milligrams of codeine over the counter. In other countries, they've minimized this. 20 milligrams, is that, why did we settle on that?
I'm not sure the milligrams is the issue, but I think it's the amount of tablets, for example. Tablets and syrup, so I think there's two different issues.
Yeah.
But, you know, for example, you can go to multiple pharmacies and come out with, you know, boxes and boxes of Advil, for example. Whereas, and they've got a large number of tablets in the box. At one point, I was able to buy a box of 100 Advil. Whereas in the UK, for example, you're limited to 24 tablets. And that would be maximum if you were taking 8 tablets a day, it would last you 3 days. And the box is very small, and it says that do not use for more than 3 days, and if you need to, go and see a doctor. So they're trying to discourage people from just self-medicating and using it day after day. You'll also find in the UK, for example, a pharmacist, we're much more vigilant. They're not just selling tablets. They actually ask you. I had a situation where I hurt my back. I was running and I went into the pharmacy and I asked for equivalent Advil, Miprodol actually, and the pharmacist questioned me. He said, "What were my symptoms?" I said, "I woke up this morning, I'd been for a run the night before and my back sore here." And he said, "Well, actually take a Panado and Voltaren gel to sort you out." And he was correct. I didn't need a product containing codeine. So, a lot of ignorance, and people get dependent. They take it for long periods of time. They don't realize that it does damage their kidneys, liver, and it causes depression as well if you stay on sugar.
That's interesting, because those are the side effects that I was looking for. Long-term use of codeine, because some people do. I mean, you will find that that they'll just take it constantly, all the time, every day. If they feel a niggle, they've got a headache, a little pain, and you'll pop a Myprodol, you'll pop a whatever contains some of the medication that you were talking to. The long-term use of codeine, what does it do to your body?
Well, I think some of the effects, as I said, was that liver damage and kidney damage would certainly be two things to look at, and the depression, and it can interact with other substances like alcohol and cause breathing problems and effects on your central nervous system. So, I think we need to be cautious. Even doctors get it wrong. Sometimes we've heard cases where doctors are keeping elderly people on codeine for very long periods of time, and it needs, because the patients demand it, and they keep giving it, and really it's not meant to be taken for such a long period of time.
You know, the one thing is also the prescription of codeine in children. I mean, you've sort of, I know on many occasions I've been to the pharmacy and I've just gotten an over-the-counter medication for my child who may be having a temperature or a headache or something, and then apparently addictions can come from this. Talk to us a little bit more about codeine in children.
I think the biggest problem we're experiencing in South Africa is the abuse of cough syrups containing codeine, or Benylin syrups and things like that. And as you sort of mentioned right at the beginning of your introduction, that is an issue, and children are using it with fizzy drinks. It's a concoction called lean, and they get high because the codeine obviously does cause euphoria. It makes one feel a bit better. It also causes sleepiness as well, but that's why they sometimes package it together with codeine. So, I think we could be looking at the use of codeine products amongst children, whether that's really necessary. I mean, they are, and maybe that should be made prescription only. But to make it prescription only for everybody, I think is moving too quickly, too rapidly, and not looking at all the potential alternatives that we should be putting in place before we do that.
What are some of the signs that you can actually look out for when or if you suspect that you as an individual, because you may be addicted, you don't even know that you're addicted because you're thinking it's harmless, it's over the counter, it's okay, I can take this. Or if you notice that one of your loved ones might be addicted to codeine, what do we look out for?
Okay, I mean, I think some of the symptoms are people just can't function without getting their codeine tablet. So it's almost like at the beginning of the day, they feel they've got a habit of cope. And I remember hearing one story from a pharmacist in the north in South Africa who talked about a businesswoman coming in and being very cross. You know, she was dressed in a business suit because he wouldn't give her more codeine tablets. And so I think one of the signs is dependence. You can't function without it. The other is tolerance. You need more and more tablets to get the same effect. Obviously, in a loved one, you'll find that they're boxed around, they're secretive behavior, and they really can't function without their codeine tablets.
Yeah. Prof, just as we start wrapping this up, we're looking for solutions around this because there is abuse of codeine. We know this. There are problems. You talk about this concoction called lean that youngsters are taking, and it's a fact and it's a reality out there. But you also said that, you can restrict it to one pharmacy, but then you just walk down the road or drive to another area and buy some more. So what should we do? We can't jump to banning it and making it over-the-counter no longer legal, and you have to go per script. What other measures can we put in place to try and control this, though?
Okay. As I said, we might need different strategies for children. So maybe we shouldn't be making it available for children to purchase. But when we're looking at adults, as I said, reducing the pack sizes, putting warning labels on boxes, getting pharmacists to inquire why people are wanting the the codeine product and suggesting alternatives which would be less harmful. I think educating people on the risks of misusing over-the-counter products containing codeine. You talked about better control of what's happening across pharmacies. And there was an initiative called the Codeine Care Initiative, which is really not functioning anymore. But I think it was a good initiative where some pharmacy chains have it, where if you're buying at, say, a Clicks pharmacy chain, it'll come up on the screen that you've just bought some down the road, and then they won't necessarily sell you more. So certainly, I think we need to link pharmacies across different chains, and that was what partly what the Codeine Care Initiative was going to do in real time. We can do that now. We have the technology to hook up all the pharmacies. I mean, they're hooked up anyway to get medical aid claims. So we hook them up, and so then they can tell whether a particular person, because you have to identify yourself to get codeine. You can't do that without handing in your identification or your card that belongs to the pharmacy group or your medical aid card, and then linking them all together to make sure that a person hasn't bought more than a certain amount within a particular time. So I think that's certainly one thing we should be doing that. So it's the technology solution, it's education, it's involved the manufacturers to produce smaller boxes.
Yeah, Prof, thanks so much. It's been an interesting conversation and quite enlightening, I'm sure. I'm sure people don't even realize that this is ongoing and it is a problem. Professor Charles Parry from the South African Medical Research Council talking to us about the possibility of codeine medication being up-scheduled. All right, let's take a break. School uniforms. Afterwards, that's the discussion we'll take.